Imagine you're a doctor. A patient walks in with vague symptoms, an x-ray is done, and before you even glance at it, an algorithm has already flagged a possible tumor. You sit down, the flagged image pops up, and the diagnosis begins. That scene isn't science fiction anymore. It's happening today. Artificial intelligence is transforming how doctors detect and diagnose diseases faster, earlier, and with greater accuracy than ever before. Welcome to the era where AI isn't replacing doctors. It's becoming their smartest diagnostic partner. In this video, we're diving deep into how AI is reshaping diagnostics in modern medicine. We'll explore the science behind it, real-world examples, and the ethical questions that come with it. Whether you're a healthcare professional, a medical student, or simply curious about the future of medicine, this video will give you an evidence-based look at what's really happening. Why does this matter? Because diagnosis is the most crucial step in healthcare. If the diagnosis is wrong, everything that follows, from treatment to recovery, is affected. According to peer-reviewed research, AI has already shown measurable improvements in diagnostic accuracy and speed across multiple specialties. By the end of this video, you'll understand what AI in diagnostics really means, how it's used today, its benefits and challenges, and what future doctors need to know to work with it responsibly. What is AI in medicine? So, what exactly do we mean when we say AI in medicine? Artificial intelligence, or AI, refers to computer systems that can perform tasks normally requiring human intelligence, like recognizing patterns, interpreting data, or making predictions. In diagnostics, there are three main types: machine learning, where algorithms learn from massive data sets such as medical images or lab reports to recognize disease patterns. Deep learning, a more advanced branch of machine learning that uses neural networks. This is the powerhouse behind radiology tools that can spot tumors in CT scans or X-rays. And natural language processing, which helps computers read and analyze clinical notes and pathology reports. When we say AI in diagnostics, we're really talking about systems that help doctors interpret images, lab values, and patient data more efficiently. Think of it as an assistant that never gets tired and keeps learning with every new data set. But remember, it doesn't replace the doctor. It amplifies the doctor's capability. Real-world applications. Let's see how this works in real life. Radiology is where AI has made the biggest impact so far. AI systems can detect lung nodules, fractures, and cancers on X-rays and CT scans, sometimes even before a radiologist notices them. In one study on diabetic retinopathy, AI screened retinal images with accuracy comparable to ophthalmologists. In pathology, algorithms can scan whole slide images and highlight regions that are likely to be malignant, helping pathologists focus on what truly matters. This saves hours and reduces human error. Then comes predictive analytics, where AI combines lab results, clinical medical history, and imaging data to predict disease risks before symptoms appear. Imagine detecting heart disease risk from subtle patterns in ECGs or blood tests that even an inexperienced doctor might overlook. And the results are real. In England, a general practice tool called See the Signs used AI to analyze patient records and boosted cancer detection rates from around 59% to nearly 66%. That's a major public health win powered by data. All this means AI is already making diagnostics faster, smarter, and more consistent across radiology, pathology, and risk prediction. Benefits and value. The benefits are massive. First, speed and early detection. AI can read and flag images within seconds, allowing earlier diagnosis and intervention when treatment success is the highest. Second, accuracy and consistency. Machines don't get tired, distracted, or biased by experience. They can process thousands of cases and detect subtle anomalies that might go unnoticed. Third, accessibility. In areas where specialists are scarce, AI systems can assist general physicians in making more accurate calls. The World Health Organization notes that AI could dramatically improve diagnosis in underserved regions. Fourth, integration with big data. AI combines imaging, genetic, and clinical data to make diagnostics more personalized and data-driven. And finally, reduced workload and cost. Automating part of the diagnostic process allows clinicians to focus on complex decisions rather than repetitive screening. But as promising as all this sounds, it comes with serious challenges, and understanding those challenges is essential if we want AI to truly benefit patients. Challenges and ethical concerns. Let's talk about the limitations. Data bias is the biggest one. AI is only as good as the data it's trained on. If data sets mostly come from one population or ethnicity, the algorithm might underperform for others. Biased data can literally cost lives. Then there's explainability. Many AI systems are black boxes. They give an answer, but we don't know how they reached it. That's a big problem in healthcare where every decision must be transparent and explainable. Surveys show that fewer than half of patients trust AI-based decisions for their treatment precisely because of this lack of transparency. Regulation and safety are evolving too. The FDA, for example, has begun creating frameworks for AI-based medical devices, but the technology is moving faster than the policies. And finally, accountability. If an AI system makes a wrong call, who's responsible? The doctor, the hospital, or the algorithm's developer. For now, liability still falls on the clinician, meaning that AI must remain a tool under human supervision. These ethical and practical hurdles remind us that while AI can be powerful, medicine is still a human-centered profession. Technology must serve the patient, not the other way around. What future doctors need to know. So, if you're a medical student, a young doctor, or a researcher, what should you be doing right now to prepare for this shift? First, develop AI literacy. You don't need to become a programmer, but you must understand how machine learning works, what data sets mean, and how algorithmic bias can affect outcomes. Second, adopt a collaborative mindset. AI isn't a competitor, it's a colleague. The best doctors of the next decade will be those who know how to use AI wisely and interpret its outputs critically. Third, ethics and communication matter more than ever. Patients will ask how an algorithm made a decision, and you should be able to explain that clearly. Fourth, data quality and governance. Know where your diagnostic data comes from and ensure it's representative and reliable. And fifth, keep learning. The tools you see today will look completely different 5 years from now. Continuous education is the only way to stay relevant. Clinicians who master these skills won't be replaced, they'll be empowered. The future, 2030 vision. Now, let's look ahead. What will diagnostics look like in 2030? We'll likely see fully integrated systems where AI brings together imaging, genomics, and wearable data to create real-time diagnostic reports. Personalized diagnostics will become the norm, where AI suggests not just what disease you might have, but which specific variant and which treatment will work best for your unique biology. Remote diagnostics will expand healthcare access globally. With portable devices and cloud-based AI, even a rural clinic could access expert-level analysis in seconds. AI will also become more transparent and explainable. The emerging field of explainable AI, or AXI, is working to make algorithms understandable to both doctors and patients. Finally, the medical workforce itself will evolve. Doctors will focus more on human empathy, communication, and complex reasoning, while AI handles data-heavy, repetitive diagnostics. In short, the future isn't man versus machine, it's man with machine, working side by side for faster and fairer healthcare. Conclusion and takeaways. Let's recap everything we've learned. AI is already transforming diagnostics, making them faster, more accurate, and more accessible. It's particularly strong in radiology, pathology, and predictive medicine. But challenges like data bias, explainability, and ethical oversight still need attention. For the next generation of clinicians, AI literacy, ethics, and adaptability will be key. The doctor of the future will be both a scientist and a data interpreter, someone who combines human intuition with machine precision. So the bottom line is simple. AI doesn't replace doctors. It empowers them, but only if we use it wisely, ethically, and responsibly. Thank you for watching. If you found this video insightful, hit the like button, subscribe to MedVax, and tap the bell icon so you never miss our upcoming videos on medical innovation.